This is a lecture session on the topic that you are going to cover. We call them as sensory areas of the brain. Now, regard to the sensory area of the brain, before that we have to identify the basic anatomy of the brain, which we already have done, but I am quickly going through the basic thing about the brain which is required from you to produce or answer during examination. So, the brain, which is a neural tissue or sole neural tissue, which is present in the central nervous system, have got some kind of like depths. It furrows into some depths. We call these furrows as sulci or sulci. Now, between these sulci, the areas of the brain, we call them as gyri. So, if you see these particular depths, this particular neural tissue is dipping, we call them as sulcus or sulci. And between this particular sulci, the neural tissue which is popped up or elevated or convoluted, we call them as gyri. This is the two basic thing about sulci and gyri. In examination, we ask you to show which is sulci, which is gyri, and like a majority of the times we get the reverse or no answer. So, which is a basic thing to start with. Now, other than this, we have understanding on the brain tissue regard to like poles, regard to like the parts of the brain tissue. We can identify the brain based on like lobes, poles, borders, etc., etc. So, we have three poles of the brain needs to be identified. One is in the frontal side, we call them as frontal pole. Likewise, this tongue opposite to the frontal, we have the occipital, and the lower side we have the temporal poles. These three poles are there that need to be identified. We have some of the like lobes of the like brains are there. We call them as frontal lobe, we call them as parietal lobe, we call them as occipital lobe, temporal, and a hidden lobe, we call them as insular lobe. We have some kind of surfaces that need to be identified. We have to identify three basic surfaces. One is the large surface, which is known as superolateral surface. One, if you cut the brain through the corpus callosum, we find a surface, we call them as medial surface. And then if you just like put it upside down, we get the inferior surface of the brain. These three surfaces need to be identified. Now, we have 6 borders in the brain. Now, we identify 3 of them. One of the border we call them as the superior medial border, which need to be identified. The next border we call it like inferolateral and inferomedial. These 3 borders like inferolateral, inferomedial, and the medial side superomedial border, these are the 3 borders you have to identify whenever this specimen of the brain is given. So, sulci, gyri, poles, borders, surfaces, and lobes you have to identify. Now, coming to this particular inferior side, if you just like flip the brain, you get the inferior surface. The inferior surface is divided into 2 parts, anterior part and posterior part. Anterior part related to the orbit, we call them as orbital part. Posterior part, we call them as tentorial part, which is related to some dura-metal fold. We will learn about that tentorial part when you take the brain out in the next post-exam session. We will see tentorial part, what the significance of the tentorial part and related to it. Now, once you identify this particular basic architecture of this brain, we go into identifying some of the sulci and some of the gyri or some of the spaces which is related to it. Now, there are very few salient features about this particular brain gross feature that you have to identify. Now, if you look at this particular surface which is projected in here, this surface is showing the lateral surface or superolateral surface. In here, I will emphasize to identify 2 of these groups or 2 of these sulci first. One is the central one, which is present over here, which you have to identify, splits this particular superomedial border. So, this central sulci that you have to identify, this is the basic thing. Then we have to identify the next one, which is known as the lateral one, this one. So, these 2 you have to identify, the basic one. If you can identify more further beyond that, you go further. If you cannot, just let go. These 2 are the must thing that you should be identifying whenever the specimen is given to you. Central and lateral sulcus. This is the most common sulci or the brain sulci which is been asked in examination, in any examination at the undergraduate level, right. So, these two basic identification that you must do in the examination, lateral, which is lateral, and which is the central one. Now, if you just like go in beyond that, in front of the central we have the precentral sulci, post to it we have the postcentral sulci. So, we name it accordingly, but again they are not essential. You must identify the lateral sulci and the central one for your examination. If you cannot identify, remember, memorize anything beyond, it's good, no problem, no harm. So, these two I will emphasize on this superolateral sulci. Coming to the cut surface or medial surface. Again, we will identify the basic sulci which is required for us. So, we have to identify the corpus callosum. On top of the corpus callosum, we find a sulci, we call them as callosal sulci. This one, callosal. And in top of that, we find a sulci, we call them as cingulate. So, this cingulate sulcus you have to identify. Next to that, we move to the posterior side. This side we have a sulci, we call them as parieto-occipital sulci, and this one we call them as calcarine sulci. They are splitting or penetrating this particular brain tissue and holding a small area of the brain which is related to the occipital pole or occipital lobe of the brain, we call them as cuneus. So, these three you have to identify. One is this one, corpus callosum, on top of that this one cingulate, parieto-occipital and calcarine, these three, nothing more. There are several others are there, just forget about it. Similar to that, if you just go to the undersurface of this brain, we call them as orbital surface and tentorial surface. If you can identify any sulci, is good. If you cannot, just let go. But I am just like mentioning two of them that if you like to, you can remember or memorize. This orbital region, we have a H-shaped sulci. We call them as orbital sulci. This one looks like H later. We call them as, by the orbital surface, we call them as orbital sulci. If you remember, it's fine. If you don't, no bothers. Now, coming to the tentorial surface of the temporal lobe, this one we see that with the dots, we call them as collateral sulcus. If you can remember the collateral, it's fine. If not, no problem. But you cannot forget about the central sulcus, you cannot forget about the lateral sulcus. You cannot forget about this particular sulci which is present on the medial side that we mentioned. This one parieto-occipital, this one calcarine and this cingulate. These are the three things are coming together, 2 plus 3, 5. These 5 you must identify in the specimens which is given to you, easily can be identifiable, right. During examination, if you can get mixed up, do not identify, go back to these particular surfaces which you are referring to. So, these are the things that again you have to come again whenever given in the examination, what surface you are looking, medial surface or lateral or superolateral surface you are looking at, then just memorize these 3, whatever the things that you have to identify. If anything beyond these 3 is asked you to identify, that is beyond our scope of identification in this practical class or practical sessions. So, we do not ask you anything beyond on this sulci in these regions, right. So, about this sulci we have to know, and we already have done about this. So, very small, very little detail about the sulci and the gyri which is related to the surfaces that we are familiar with, we will be identifying it. Coming to the lobes, we should be able to identify, name the lobes which is related to it, like in front of the central sulcus, this lobe in the green we call them as frontal. Posterior to it in yellow we call them as parietal. This one in below, the lateral sulcus, we call them as temporal, and on the red margin over here which is related to the posterior side which is known as occipit. Now, we cannot see one lobe or one part of the brain which is lying deep to the lateral sulcus If you split this, spread this, we find deep to it, which is a hidden sulcus. We call them as insular or insular cortex or insular sulcus, insular lobe or insular regions. So these are the basic understanding on the lobes on the brain that is required for us to identify in the gross practical classes. 5 of them, lobes, poles and borders, that 3 of them that you have to identify. Moving to the point of today's discussion. Now as you see these brains, just like we remember the thing we talked about, this lung, and we split the lung into small districts, we call them as bronchopulmonary segments, and that we learned that there are 10 such districts in the lungs that they are separated in a small regions. Likewise that in the brain as well, we split this brain into the functional areas. How the brain is functioning, we split this area in the small district. Now the brain functions have got simplified in terms of how the brain tissue is function. That means it may be doing motor action, it may be doing sensory action. So based on this, we split this brain based on how it is working and how these neurons of a particular region is working. We identify that the areas of the brain or functional area of the brain. We had a German physicist who divided this particular brain into small districts like bronchopulmonary segment into 39 quadrants, and we call them areas of the brain. Now these areas of the brain is named by the name of the person who divided that. We call by the name of the discoverer, we call them as Broadman's area. So this brain can be separated, split into, according to the functions of the brain, into 39 separate regions. So each of these 39 separate regions are functioning or assisting in functioning in different functions. Some of the areas is doing motor action, some of the areas is doing sensory action, some of the areas is doing association. That means they are integrating. So whatever the area motor doing and the sensory part is doing, they are coordinating between them. So based on these areas, we call them as Broadman's areas of the brain. We divide this brain into 3 different areas: motor areas, sensory areas and association areas. So that means they are linking or linking areas. And who discovered it? This physicist or this neurophysicist, Broadman. Based on Broadman, we divide these particular regions into Broadman's areas of the brain. Now you divide the brain into 39 quadrants. Now for us, we do not have to know or remember these 39 areas or the quadrants. I have simplified some areas of the brain which we must identify for the examination purpose, which comes in the examination and also very essential for us to understand for the undergrad level. So we focus onto those areas of the brain which I am strictly speaking in, and you will be learning those areas on them only. Anything beyond that we do not have to explore through, because they are unnecessary at this level. Even this particular brain is a super specialized topic. That means we do masters and then we do super master. Then these areas maybe we have to have an idea about. Again, we are not going to be a researcher. If you are going to do research on it, then you have to dig deep and deep and deep on it according to the areas. For us, we'll strictly speaking, will be restricted to these brain areas which is required for us. So I'll be isolating some areas of the brain, we call them as motor areas. I'll be isolating some areas of the brain which is sensory, and some of the association areas which is relevant, required for our clinical understanding. So we'll start with this particular areas of the brain which is related to us in the frontal lobe. Now in the frontal lobe, we have to identify this area of the brain which is lying in front of the central sulcus. So we have to identify the central sulcus which is cutting this particular superolateral, and in front of this region we call this area as primary motor cortex or precentral gyrus or area 4. So this area is the central sulcus, and in front of the central sulcus you see this particular area. We call this area as a primary motor cortex or area 4. So what is the functions of it and how this particular area is related to us? This is a primary motor area. Now what is the primary motor area? That means this particular area controls the motor activity. So this region of the brain controls all the motor activities in the body of the opposite side of the half. That means we have two halves of the brain, right cerebral hemisphere, left one. Right one is controlling the left half of a body and the vice versa. Left one is controlling the right side of the body. So this primary motor area, we name this primary motor area as number 4. So primary motor area number 4, which is a primary motor cortex, that means it is the motor region or motor headquarter of our body. It controls every motor activity. Now to control this motor activity, it does all the necessary work. To help these things out, we have a association motor areas which is lying in front of it. But we are not just going into it. We just focus into the primary headquarter of the motor activity. We call them as primary motor area or area 4. We have to know the number area, number 4 or primary motor area. Where it is located? It's located to pre-central gyrus. That means central sulcus, go ahead of that gyrus which is in front of the central sulcus. We call them as pre-central gyrus. It's the house for this area 4. And what this particular area is doing? It's controlling this voluntary motor control on opposite side of the body. Right half, left half control, left half, right side control. That's it. So primary motor area number 4. This is, we have to remember. Now next area, we'll be coming into this particular picture. What does it explains to us? Then another motor area, we call them as frontal eye field area number 8. Now, where is this area? This area is this one, area 8. So this is the frontal region and this is the occipital region. This is central sulcus and this is central sulcus and this is area 4. That means the motor area. In front of this region, we call them as frontal cortex. Frontal cortex is divided into this frontal gyrus, into this region, superior, middle and inferior frontal gyrus. So these regions out here, we have this middle region which is lying in front of this area 6 or motor association area. We call them as area 8. This area 8 is called them as frontal eye field. Now frontal eye field or area 8, what it does? It controls the eye movement. That means if you are moving the eye to right side or left side, they are moving together. It's not like our right eye is moving right side, left eye is moving to the left side. It's not happening, right? We call this movement as conjugate eye movement. You get it? That means if you will hear a noise, both of the eyeballs moves to the right side or left side to that region. So it's not that I can turn my right eye to the noise side and left eye to the opposite side. You cannot do that. So this kind of movement, we call them as conjugate eye movement. So it is moving together, conjunction or together and moving with the time or area where you want to. So this control of the eye movement is controlled by this motor area. We call them as frontal eye field area. What's the location? Location is frontal gyrus. And which frontal gyrus? Middle frontal gyrus. So it's the middle part of this particular prefrontal cortex where we have this area which controls the voluntary movement of the eye. We call them as voluntary eye movement or conjoined eye movement of this individuals. So right side, left side together works together and makes this. So this movement or motor, this area that we have to keep in mind. Next one, this most important one I would emphasize on for the undergraduate level. We call this as the speech area. Now, the speech in simple words we split into two parts. One we call them as motor part, other is called as sensory part. Now, why we call them as motor part and what do we all call it as sensory part? Now, as I am talking, I am articulating, right? So, I am articulating, that means I am producing the voice. So, a part of the speech is producing the voice with the articulation, so that my tongue and the voice box is moving in a right direction. The other thing about of this particular speech is that if I ask you a question, you answer it to me. I do not know or I know this, right? That means whatever the question I am asking, your brain is receiving and accordingly replying to it. So that part we call them a sensory part. If you cannot understand what I am asking, that means you cannot answer it properly. I will say, how's the weather? You will say that I like dissecting. That means you have a discoherence of the answer what I am getting. So you are not listening, that's why you are giving wrong answers, right? And this applies for you for the examination as well. So during examination, examiner asks something and you answer something. And then examiner say, why you are saying this? You said, okay sir, I have some kind of like a Broca's area or Wernicke's area problem. So this is what we call them as the speech areas. Now this speech area is sensory part and the motor part is located in two different areas of the brain. And they have two different names. So the motor part of the speech productions, we call them as Broca's area, also known as motor speech area of 44. So we have to identify the area 44 which is present in here to this underside of this frontal lobe, the frontal cortex and inferior frontal gyrus over here. So this region of the brain is controlling the speech articulation. Now other part we call them a sensory part. Now that means the other area we call them as area sensory speech area of Wernicke's, which is known as area 22. So this area is opposite to it. You see that this lateral sulcus on this top of this, this is lateral sulcus. Towards this occipital pole we have this Broca's area, and this, this is the Wernicke's area, this is the Broca's area towards the frontal pole. So this Wernicke's area is the sensory speech area. So this speech area we call them as area 22. So this area 22 controls or recognize the voice or the sound. So if you are not able to identify the words or the voice properly, you cannot answer this appropriate answer. We will have this whole thing jeopardized together. So that's why these two areas, or Broca's or Wernicke's area, which controls the speech area, is split into two parts. We call them as motor control of speech and sensory control of speech. Sensory control of the speech comes from the Broadman area 22. Recognize this thing which you are saying and understanding it and stating it to the areas of the brain, and which is making the speech, which is Broca's area of the brain. We call them as motor speech area 44. It is producing the speech or producing the voice which is articulated. Areas we call them as speech areas. Whenever we get a questions on the speech area of the brain, we have to mention both of them. That means if you get a 4-mark short question on the speech area, you have to mention that this brain area of the speech is split into two parts, sensory part, motor part. Sensory part does what? Which area is called this area. Motor part controls this area is known as this. So these two pieces of information together you have to mention. Now, if you have any diseases affecting this region, accordingly you have a problem. So, if for example we have this Broca's area which has a problem, that means it have got cerebrovascular accident or brain hemorrhage, this Broca's area is knocked out. That means it's not getting blood supply to that region. That means Broca's area not producing anything which is coming on. That means whereas the Wernicke's area or the sensory speech area is fine. So what will happen to the patient, that they will understand what the person is saying, but they will unable to answer. And this area, which is Wernicke's area, if it is damaged, the questions you will be asking something, the answer will be coming in something else. So that means they have a discoherence in the understanding of the information and they are articulating something, right? If both of the areas are damaged, then we have complete problem with this. We call this as aphasia. We call them as sensory aphasia or motor aphasia or global aphasia. That means both of them are not doing all. Neither motor, neither sensory, neither they can understand, neither they can say anything. That can happen, right? So this is a clinical problem we see most commonly coming to us as the short note exam questions. Last time, before last time or last time or in a supplementary question, they had this particular problem like aphasia or this Wernicke's area problem. They are given a clinical questions on it. Now, moving to this region, another region that you have to understand over here, we call them as primary auditory area. That means this area is dealing with the auditions. That means related to the hearing, they are dealing. This area is lying on area 41 and 42. Just under this lateral sulcus, they are present on this region. So this region short over here, we call them as area 41 and 42. They are divided into two parts, primary and secondary auditory areas. What do? They receive the sensory inputs, whatever they are coming through the ears. Coming through the ears or cochlea, they are going to these bodies, we call them as lateral geniculate bodies. From there, they are reaching to that part and they are understanding whatever the things are coming. So this auditory area is receiving the sound which is coming from the ear. So this auditory region has a close association with this vernix area which is recognizing the words. So this vernix area and as well as this primary or secondary auditory area 41, 42, they work together in reality when they are functioning. So this area or primary auditory area, also you have to know about the area number and what do they do exactly and location of it. Next one, we call this area another very important area. We call them as primary visual area or visual cortex. Now before that we talked about an area which is related to the vision, which is known as frontal eye fields, which is controlling the eye movement. This one we call them as vision. That means whatever things we are seeing that's coming through the eyes is falling on the retina and it is taken by the optic nerve and reaching to this part of the brain. Which area? We call them as area 17. This area we have these neurons arranged in a way they look like striations. That's why they are also known as striate areas. Striate area 17, 18 and 19. They are the visual area or primary visual cortex, secondary visual cortex or association cortex. What do? They receive the inputs which are coming through the eyes and analyzing it of the opposite side. So this area we call them as primary visual area or area 17, we call them as striate area. Again, it's very important. So we have to understand this particular area, we call them as primary visual area and separate it out from this frontal eye field which is area 8. So you just do not get mixed between them. So visual cortex which is present in this region is area 17, is dealing with the images that is falling on your eyes, the pictures, and the pictures need to be identified based on what you are looking at. So if you have to move your eye, that movement is controlled by the area 8. So these two things falls or cooperates with each other. So again, these particular areas which is known as primary visual areas and this frontal eye field, they are very commonly being tested in examination, because in examination we often do not understand and comprehend the two things, what you are looking or movement of the eye, that means your eyeball is moving, and other thing what the picture you are getting. So the picture you are getting is falling on the retina which is coming and ending into this 17 and helped by association with this area 18 and 19. We call them as primary visual area, visual association area, and this particular area 19 and 18 is helping the area 17 to work to clarify the image, clarify the color, clarify this particular thing which is related to this particular contrast of this matter. What this area 8 is doing is controlling the movements of the eye. That means extraocular muscles movement is controlled by this, and these two is working together, conjoined. That means this area is working on opposite side as well. So these things you have to keep in mind related to it. Many a times we see that there is a hemorrhage involving this occipital pole which is supplied by the posterior cerebral artery. So if not, we have identified the blood supply to the brain will be soon coming to the blood supply of the brain, and in the blood supply of the brain will come into the circle of Willis, which is contributed by some of the arteries in the brain. So some of the arteries in the brain which supplies out here, we call them as posterior cerebral artery. That posterior cerebral artery, if it is thrombosed, blocked, will lose the vision, right? Right. So these two you have to understand. Now if you lose the vision, that doesn't mean we are not being able to move the eyes. So the movement of the eye and the vision are two separate entities. During examination, these exam simple question are being asked in examinations. So this area, say for example highlighted over here, will be given to you to identify, and they will ask you what this particular thing is doing. You say this is eye movement or eye thing, something like that, and they will be asking, so this area, if it is damaged, will you be able to move your eyes or will be unable to see the images? That's what you have to identify properly. So this concept of visualizing the thing, seeing the thing and movement of the eye, these things you have to clear your mind about what these particular areas are doing. So this is what we have to identify related to the primary visual areas. Coming to this area, which is coming at the last, I would say, this parietal lobe, and this parietal lobe has one important area which I have figured out or which I have separated out. In the parietal lobe, which is lying posterior to the central sulcus. The posterior to central sulcus, we call them as post-central gyrus. The post-central gyrus, that particular area is holding the area, we call them as area 3, 1 and 2. So this particular area 3, 1 and 2, we call them as primary somatosensory area or primary sensory area. Now this primary sensory area can be divided into primary sensory area 1 and 2. What they do, by the name it implies they hold this capacity to understand the sensory inputs, whatever things are coming to your brain. So this inputs, so whatever the body is bringing, they are reaching to this particular area. Touch, pain, temperature, discriminations, all these sensory inputs are coming to this part of the brain and analyzed and discretely differentiated over here. The sensation, joint position, vibration senses, they are analyzed this area. We can divide this area into primary and secondary area. We call this primary sensory area 1 and primary sensory area 2. So this red and this particular blue, these are the two highlighted area that commonly been examined, asked questions. Central sulcus, in front of the central sulcus, we have the primary motor area 4. Posterior to it, we have the green area, which is somatic or somatosensory area 3, 1, 2. Sensory area and a motor area that we should be able to identify, pre-central gyrus and post-central gyrus. This commonly been tested in examination. That you have to understand. This primary sensory area can be split into two areas, S1 and S2. Don't need to bother about that. They are doing the some lower level and higher level integrations at this level. But basically they are doing the same sensory actions. That means touch, pain, temperature, integrations of the joint positions and the proprioceptions or movement of the joint are done by these particular agents. So these are the things that you have to understand related to these particular areas of the brain, or these areas, or we call them as functional areas of the brain. So whenever you are giving to this particular picture, these are the districts, whatever these things are identified of. Out of these 39 areas, we are identifying couple of areas which is important to us. Area 4, area 3 and 2, area 17, area 8, Broca's area, Wernicke's area, 41, 42, 39, like this. We have to identify this, and significance all of these areas we must identify properly whenever you are identifying it. Now coming to this particular picture or explaining this, what does it mean? Now this particular thing we call them as homunculus. This is a map. How this particular map is representing? This particular map is representing how this particular areas of the brain is understanding the part of the body. So for example, we have the sensory cortex, that means area 312. This one is area 4. Now this particular region is identified the different parts of the body. Now this is on reverse direction. That means as you go from above down, the body is interpreted like this. So on the superior lateral margin, on the top side, we have the leg interpretations. As we go down through this particular line, we see this particular face, neck, body, face, neck and the tongue is interpreted. So this is an inverse relationship of the interpretations of the body is comprehended. Now see that these regions of the body, these regions of the brain is identifying the region, we call them as involving the lower extremity. This region is identifying the neck region or the throat region. So this is in inverse relation. So above down, it's a inversely. So above, this is interpreting both this side and this side is interpreting the lower part of the body. As we go down, this is interpreting the upper part of the body, neck region, throat region, tongue region, etc., etc. So this map, we call them as homunculus. So as we go on the medial side, we see the toe, ankle, knee, then we go by this particular arm, shoulder, etc., etc. Then we go to the lip, face region, and eventually to the tongue and the inner side of the body. Similar thing over here on this sensory area as well. So the sensory interpretations and the motor interpretations of these areas are in a reverse direction. Now, why it is important? It's important because, say for example, you have a vascular accident or brain hemorrhage involving this region of this small region of the brain, and this motor cortex of this region is gone. That means the motor part of this controlling region will not be functioning properly. This part controls the region which is related to the leg or this particular groin region. That means the person will be losing the motor activity of the lower part of the body, whereas the upper part of the body is working fine. So this is how we interpret according to the domain of the vascular insult that particular person is having. So when you graduate to higher class, we get this particular map of this particular picture in a angiographic picture, where you see the exact locations of the hemorrhage, exact locations of the ischemia, and we can identify and justify which part of the body is not working or not functioning and why is it not functioning. We have to explain it likewise. But anyways, we are going to identify these areas which I have just like highlighted, somatic areas, and out of these motor areas in this particular part of the body that we need to understand or need to identify. We have to identify the primary auditory area and the number on them. We have to identify this particular area with importance, Broca's and Wernicke's area, and the number and the significance of that. We have to identify this frontal eye field. We have to identify this particular area, we call them as primary motor area, and as well as we have to identify this primary visual area, also known as striate area or striate cortex. In physiology, they will teach about this particular striate cortex. They will talk about this particular optic radiations, optic projections, how this image is coming and falling in the eye and which part of the brain is working, and if you have a vascular insult, what happens to the individuals. So this region is primarily been tested in examination in the theory class, in theory parts. But having said that, in your specimen, if you are given with the specimen like this, and once this particular specimen over there given, you identify the central sulcus, they ask you to identify the precentral gyrus and the postcentral gyrus, and they ask you about the areas or the functional areas. You should be able to mention about the functional areas in front of the frontal sulcus and behind the central sulcus, and what functional area that is representing and what they are doing. What is motor thing, what is non-motor thing, and what the area number, etc., etc. Say for example, if they reach to this particular region, to the occipital pole, and say about this region is that area 17, and what's area 17 is controlling off, you should be able to tell about this is the visual cortex, also known as striate cortex, and what exactly they are doing. So likewise, you can be tested in examination as well, denoting this area in the practical class, and theory, Broca's and this Wernicke's area are very high yield areas that you must prepare for. So this is about these areas of the brain. Prepare these particular areas of the brain for your examination, which is included in your curriculum, which is high area for the brain. And 39 areas or whatever the areas, rest of them we just let go. Like if you have enough practical days left, we'll take out the brain from one of the cadavers for interest and see how this particular brain actually looks like. If we have time, we'll remove the spinal cord as well, depending on how much time we have on this particular brain specimen. But again, in the brain specimen, we strictly restrict the questionnaires based on very basic elements. We do not ask you about too flowery questions about this particular neural tissues in examination and as well as in the interviews as well. And in the tagging, during the exam tagging as well, we restrict it to the prime areas where is usually there. Say for example, we will be tagging, for example, this particular area of the brain, and then we'll just like put a pointer over here and ask you about what area is related to this particular point regions. If you just like have this particular central sulcus, we put a pointer there and ask you about gyrus and what it controls there and what it does in functions. So you should be able to understand and identify this particular basic question.